We now move on to consequentialist theories. Consequentialist theories in general opposes with duty theories, because based on what I said a while ago, duty theories or deontological theories are non-consequentialist. They don't look at the consequences of our actions, but they rather look at the reason for doing something good. Now, consequentialist theories obviously looks at consequences. If the consequences are pleasurable or if the consequences are good, then we have to do that thing. If the consequences are bad, then we have to avoid that. That's a general principle in consequentialist theories. An action is morally right if the consequences of that action are more favorable than unfavorable. Okay. Consequentialist normative principles require that we first tally both the good and bad consequences of an action. So, if we are in doubt of a particular action, we have to tally, or we have to weigh things out, or we have to determine what would be the good consequences and the bad consequences. For example, your girlfriend is pregnant. You know that your girlfriend is not physically, emotionally, and financially ready to face that parental responsibility. And you know that your girlfriend's parents don't want their daughter to get pregnant at this time. So you might ask yourself, is it morally right to abort the child that your girlfriend is carrying in her womb? Consequentialist theories would want us to tally the good and bad consequences, and we follow that course of action which has more good consequences than bad consequences. We then determine whether the total good consequences outweigh the total bad consequences. If the good consequences are greater, then the action is morally proper. But if the bad consequences are greater, then the action is morally improper. You don't have money right now, and your mother is in the hospital. Your mother needs, or you need money for the hospitalization, for the medicine, and for the operation of your mother, but you don't practically have any money at all. Question: is it morally right and proper to steal money from the bank? So we have to weigh things out. If you steal the money from the bank successfully, then you will be able to pay for the hospital bills, you will be able to buy medicines, and you will be able to pay for the operation of your mother. But the other side of the coin will tell you that stealing money from the bank will endanger the money that other people deposited in that bank. So which is greater, to steal or not to steal? Consequentialist theories in general wants us to look at the good consequences and the bad consequences of our actions. If there are more good consequences than bad consequences, then the act is moral. But if there are more bad consequences than good consequences, then the act is immoral. Consequentialist theories are sometimes called teleological theories. A while ago, duty theories are called deontological theories, from the word deon, which means duty. At this time, consequentialist theories are sometimes called teleological theories, from the Greek word telos, or end, since the end result of the action is the sole determining factor of its morality. Consequentialist theory is looking at the result. It is looking at the consequences of the actions. That's why it's called teleological or N or telos. Okay. There are three subdivisions of consequentialism, namely ethical egoism, ethical altruism, and utilitarianism. And we will discuss this one by one. Okay, let's take a look first at ethical egoism. Now, what is ethical egoism? In ethical egoism, an act becomes morally right if the consequences of the action are more favorable than unfavorable only to the agent performing the action. Now, going back to the example I gave a while ago about stealing money from the bank, obviously, it's only you who are benefited from that act. Hence, it is considered as ethically egoist, or it can be categorized under ethical egoism, because only the agent or only you are benefited from performing the action and no one else, while the rest of the people are not benefited at all. Now, what about ethical altruism? In ethical altruism, the act is more favorable than unfavorable to everyone except the agent. Now, this is the exact opposite of ethical egoism, because in ethical egoism, only the person or only the agent is benefited, while in ethical altruism, everyone is benefited except the self or except the agent. As seen in the picture, you can see that out of the 5 persons, the 4 persons are benefited from the act of the single person who sacrificed himself for the benefit of the other 4. Now, the third category under consequentialism is what we call as utilitarianism, in which the action or the consequences of that action are more favorable than unfavorable to everyone. So everyone is benefited, not only the self, not only others except the self, but the self including others, or in short, everyone. For example, wearing face masks in this time of pandemic, or wearing face masks and observing social distancing at the height of the spread of COVID-19 is practically favorable to everyone, because by doing so, you are preventing yourself from contracting the virus. At the same time, you are avoiding others from getting contracted with the virus if you are positive of the disease. So this is a win-win situation in which everyone is benefited. One philosopher who subscribes to the concept on consequentialism is Jeremy Bentham. Specifically, Bentham is famous of his utilitarianism principle. Again, utilitarianism, based on what we discussed a while ago, an act is morally right if the consequences are favorable than unfavorable to everyone. So we are looking for that act which is favorable to everyone, and we call that as utilitarianism. And one major proponent of utilitarianism is Jeremy Bentham. He proposed that we tally the consequences of each action we perform and thereby determine on a case-to-case basis whether an action is morally right or wrong. And he calls this as act utilitarianism. And then there is also another aspect of Bentham's theory of utilitarianism, which is known as hedonistic utilitarianism. Hedonistic, again, the key word here is pleasure. So we do the act which gives pleasure. For Bentham, pleasure and pain are the only consequences that matter in determining whether our conduct is moral. If the act produces more pleasure and less pain or no pain, then the conduct is moral. But if the conduct produces more pain and less pleasure or no pleasure, then the act is immoral. We now proceed to the third general subject area of ethics, which is applied ethics. So in applied ethics, we will use ethical principles, or the principles in normative ethics will be applied in certain areas. It involves examining specific controversial issues such as abortion, infanticide, animal rights, environmental concerns, homosexuality, capital punishment, or nuclear war. By using the conceptual tools of meta-ethics and normative ethics, discussions in applied ethics try to resolve these controversial issues. In other words, we use the principles in meta-ethics and normative ethics in applied ethics. Or applied ethics is called so because we are now applying the principles in meta-ethics and normative ethics. For example, we have biomedical ethics or bioethics. We also have business ethics. We also have environmental ethics and sexual ethics. Now, there are two features necessary for an issue to be considered an applied ethical issue. First is the issue needs to be controversial in the sense that there are significant groups of people both for and against the issue at hand. So there are people who are in favor and people who are against. For example, poverty. Poverty is not an ethical issue at all. But are we going to help the poor? Now poverty now becomes an ethical issue. Should the government help the poor? Yes or no? So that's the time that, or should the Philippine government continue the four Ps, or giving out subsidy, cash subsidy or financial aid to the poor? Should the government continue that? Now that becomes an ethical issue. Is it the responsibility of the government to financially help the poor? Or does helping the poor make them more dependent on the government and thereby making them poorer? So that's where ethical issues come in. That there's got to have people both for and against the issue. And second requirement for an issue to be applied ethical issue is that it must be a distinctly moral issue. Not all social issues are moral issues. Poverty is a social issue. Poverty is a social issue, but it also has moral issues attached to it, like the ones I raised a while ago. To qualify as an applied ethical issue, the issue must be more than one of mere social policy. It must be morally relevant as well. Like wearing masks and following social distancing are social policies. But when do they become social issues? They become social issues when we talk about liberty or curtailing our freedom. Who is responsible for the preservation of our health? Ourselves or the government? Who should decide what we should do? Who should decide when and where we should wear masks? Is it the government or the self? In that case, wearing masks or social distancing do not only become social policies, but they also have social relevance. They also have moral relevance. Now, the principles most commonly appealed to in applied ethical discussions are the following. We have personal benefit. We acknowledge the extent to which an action produces beneficial consequences for the individual in question. And then we also have social benefit. We acknowledge the extent to which an action produces beneficial consequences for society. And the principle of benevolence, that we need to help those in need. Principle of paternalism. This is the principle that doctors observe, that since patients cannot personally cure themselves, and doctors are the ones trained to treat people with diseases and health issues, that they are duty-bound to assist others in pursuing their best interest when they cannot do so themselves. The principle of harm, or do not harm others, principle of honesty, principle of lawfulness, principle of autonomy, acknowledge a person's freedom over his or her actions or physical body. This is the issue that I was raising a while ago, autonomy, the wearing of face mask, or even wearing of helmet. Wearing of helmet is an issue to other people. Should the government interfere in our decision when to wear and when not to wear helmet when riding a motorbike? Or should the government interfere when and when not to wear face mask? Now that's a question of the principle of autonomy. The principle of justice and then rights. Acknowledge a person's rights to life, information, privacy, free expression, and safety. Okay, let's take a look at this example. This is a true story which happened in 1982 in Bloomington, Indiana, USA. This is a story about a couple who gave birth to a baby with severe mental and physical disabilities. Among other complications, the infant, known as baby doe, had its stomach disconnected from its throat and was thus unable to receive nourishment. Although this stomach deformity was correctable through surgery, the couple did not want to raise a severely disabled child and therefore chose to deny surgery, food, and water for the infant. Local courts supported the parents' decision, and 6 days later, baby doe died. So the situation is about baby doe who is physically and mentally disabled, but such disability is correctable through surgery. But baby doe's parents chose to deny surgery, food, and water to the baby, resulting to the death of that baby. Assessment number 3 is your answer to the question, should corrective surgery have been performed for baby doe? Why? Why not? Defend your answer. Post your answer in Messenger or in the group chat. React, comment, disagree, or agree with your classmates' answer. Because in that situation, baby Do's parents decided not to undergo the corrective surgery because they don't want to raise a disabled child. But would you rather believe that corrective surgery should have been performed? I'm excited about your answers to this question. Now, argument in favor of corrective surgery derive from the infant's right to life and the principle of paternalism, which stipulates that we should pursue the best interest of others when they are incapable of doing so themselves. Take note of the right to life. That baby doe, even if he or she has physical and mental disabilities, he or she has the right to life. And doctors have the duty to perform corrective surgery, or they have the principle of paternalism. While arguments against corrective surgery derive from personal and social disbenefit, which would result from such surgery. If baby doe survived, its quality of life would have been poor, and in any case, it probably would have died at an early age. So the question now, should corrective surgery have been performed on baby doe? So this is now a question of moral personhood. What should it be like to be a person or human? Do we become less human if we have physical or mental disabilities? Were the parents of baby doe right in their decision to deny baby doe the surgery which could have saved his life? Or on the other hand, if we perform corrective surgery on baby doe, will he or she just suffer and die at an early age? So even if there is surgery, there is no assurance that baby doe would live a long life. So this is an example of an ethical issue in which principles from meta-ethics and normative ethics are being applied to resolve a certain moral issue. Now, issues in applied ethics, we have biomedical ethics, business ethics, environmental ethics, sexual ethics or sexual morality, and then social morality, and so on. In biomedical ethics or medical ethics or bioethics, ethical principles are applied in clinical settings or hospital settings. So healthcare workers are in an unusual position of continually dealing with life and death situations. So issues like infanticide or surrogate motherhood or surrogate parenthood, genetic manipulation, abortion are being dealt in medical ethics or biomedical ethics. Other issues arise about patient rights and physicians' responsibilities, such as the confidentiality of the patient's records and the physician's responsibility to tell the truth to dying patients. And then additional issues concern medical experimentation on humans, the morality of involuntary commitment, and the rights of the mentally disabled. That we cannot use persons to participate in a clinical trial without explaining to them the effects of the medicine that will be injected to them, as in the case of the studies right now ongoing relative to the vaccines that will cure COVID-19. End-of-life issues arise about the morality of suicide, the justifiability of suicide intervention, and physician-assisted suicide and euthanasia. If the patient is terminally ill and is suffering from a disease which is incurable, is it justifiable to have euthanasia or assisted suicide? So issues like this are being dealt in biomedical ethics. One of the issues inherent in COVID-19 pandemic is the way we manage dead bodies of persons who died of COVID-19. In this article that I wrote and is published in UBio's Journal of Asian International Bioethics, are argued that human bodies, even when they are already dead, it remains a subject and not an object, and therefore it is entitled to the dignity that it has while it was alive. And so, in this article, I argued that dignity of death should not be deprived to COVID-19 patients, and dead bodies during COVID-19 should not be objectified or treated as objects. Because in this article, I argued that based on anecdotal accounts, some people who died of COVID-19 or even non-COVID-19 deaths are being deprived of dignified death, just like giving them a dignified send-off from their loved ones. Another is business ethics. In business ethics we deal with social responsibilities of capitalist business practices, the moral status of corporate entities, deceptive advertising, insider trading, basic employer rights, job discrimination, affirmative action, drug testing, and whistleblowing. And then in environmental ethics, we examine issues which include rights of animals, the morality of animal experimentation, preserving endangered species, pollution control, management of environmental resources, whether ecosystems are entitled to direct moral consideration, and our obligation to future generations. And then sexual ethics or sexual morality deals with issues that include monogamy versus polygamy, sexual relations without love, homosexual relations, and extramarital affairs. Lastly, in social morality, we deal with issues which include capital punishment, nuclear war, gun control, the recreational use of drugs, welfare rights, and racism. So far, we have discussed in this session the definition of ethics, the subdivision of ethical theories into three general subject areas, namely meta-ethics, normative ethics, and applied ethics. And then under each area we have discussed, as in the case of meta-ethics, we have discussed egoism and altruism, emotion and reason, male and female morality, and then under normative ethics we have discussed virtue theories, duty theories, consequentialist theories, and under applied ethics we have discussed different issues in applied ethics. Now these topics and subtopics will be elaborated in our future sessions. Now the line of distinction among subdivisions of ethical theories is blurry, meaning to say there is no specific line that divides meta-ethics, normative ethics, and applied ethics. They somehow overlap with each other, and the distinction is complex, is more complex than we think it is. And for your assessment, number 4, please answer the following questions. Concerning the origin of ethical concepts in meta-ethics, which between otherworldly view and this worldly view do you agree or favor with? And then defend your answer. If you are convinced with this worldly view, who should create moral standards? Moral individual or society? Defend your answer. According to Thomas Hobbes, many if not all of our actions are prompted by selfish desires. There are still selfish causes, even if an action seems selfless. What is your comment or reaction on this? Last, concerning the underlying basis of our moral judgments and conduct, what should we follow? Emotion or reason? Defend your answer. For your output in assessment number 4, just the same with your previous outputs. Write your answers in your notebook, take a picture of your output and submit output number 4 to your instructor's personal messenger account. Notebooks will be collected before the midterm exam and or final exam. Take note, please refrain from having lengthy yet irrelevant answers. Go straight to the point. Thank you. That ends session number 3. See you in our next session.